Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test. Listening Test. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a conversation between an interviewer and Dr. Emily Harris discussing medical innovations today. You now have 90 seconds to read questions.
Hello and welcome to Medical Innovations today. For years, antibiotics have been the go-to treatment for various bacterial infections. However, recent research from a global consortium of medical experts suggests that overuse of antibiotics may do more harm than good. To discuss this critical issue, my guest today is Dr. Emily Harris, a leading infectious disease specialist from Harvard Medical School. Dr. Harris, welcome.
Thank you for having me.
So, Dr. Harris, why have antibiotics been prescribed so liberally for so long?
Well, it's a great question. Historically, antibiotics were seen as a miracle cure, and they have saved countless lives since their discovery. However, the challenge is that as their use became widespread, they started being prescribed for conditions that they might not be necessary for, like viral infections. This overprescription stems from a combination of patient expectations, the medical community's desire to provide a solution, and a lack of awareness about the long-term consequences of antibiotic overuse.
So, would you say this is more of a cultural habit than a scientifically backed practice?
Absolutely. In many cases, the decision to prescribe antibiotics was driven more by tradition than by evidence. When antibiotics first became available, they were used cautiously, but over time, as they proved effective, the threshold for their use dropped. This wasn't always based on rigorous science, but rather on the belief that they were a quick fix. We now know that using antibiotics indiscriminately can lead to antibiotic resistance, which is a significant public health concern.
That brings us to the issue of antibiotic resistance. How serious is this problem?
It's a very serious issue. Antibiotic resistance occurs when bacteria evolve to survive the drugs meant to kill them. This means that infections that were once easily treatable can become deadly because the antibiotics no longer work. According to the World Health Organization, antibiotic resistance is one of the biggest threats to global health, food security, and development today. It's estimated that by 2050, antibiotic-resistant infections could cause 10 million deaths annually if no action is taken.
That's quite alarming. What steps are being taken to combat antibiotic resistance?
There are several strategies being implemented globally. First, there's a push for more prudent use of antibiotics, only prescribing them when absolutely necessary and ensuring the right drug is used for the right infection. Second, there's a significant focus on developing new antibiotics and alternative treatments. Finally, education is key, both for healthcare professionals and the public, to reduce the demand for antibiotics when they are not needed.
Have there been any major successes in these efforts so far?
Yes, there have been some notable successes. For example, in countries like Sweden and the Netherlands, strict guidelines on antibiotic use have led to a significant decrease in antibiotic resistance rates. Additionally, global initiatives like the WHO's Global Action Plan on Antimicrobial Resistance are making strides in raising awareness and promoting research. However, there's still a long way to go, especially in countries where access to antibiotics is less regulated.
And what about the future? What can we expect in terms of advancements in this field?
The future is promising, though challenging. Researchers are exploring new types of antibiotics, including those that target specific bacterial mechanisms, reducing the likelihood of resistance. There's also exciting work being done on phage therapy, which uses viruses that specifically target bacteria, and on harnessing the immune system to fight infections. The key will be balancing innovation with responsible use to ensure that we don't find ourselves in the same situation with new treatments.
So, to summarize, should people be worried about antibiotic resistance, and what can they do to help?
Yes, it's definitely something to be concerned about, but it's not too late to make a difference. People can help by not demanding antibiotics for viral infections like the cold or flu, by following their healthcare provider's advice when they are prescribed antibiotics, and by practicing good hygiene to prevent infections in the first place. Every small action contributes to the larger fight against antibiotic resistance.
Thank you, Dr. Harris, for shedding light on this important issue. It's clear that while antibiotics have been a powerful tool in medicine, we need to be more mindful of how we use them.
Thank you for the opportunity to discuss this critical topic. Extract 2. Questions 37 to 42. You hear a doctor giving a presentation about evolving role of telemedicine in healthcare. Now, read the questions. You now have 90 seconds to read questions.
Hello, I'm Dr. Amelia Hartman. Today, I'd like to discuss the evolving role of telemedicine in healthcare, particularly in light of recent technological advancements. Telemedicine is not a new concept, but its significance has grown exponentially, especially during global health crises. What once started as a tool for remote consultations has now expanded into a comprehensive platform that supports everything from chronic disease management to mental health services. One of the most compelling aspects of telemedicine is its ability to break down geographical barriers. Traditionally, patients in rural or underserved areas had limited access to specialized care. Now, with telemedicine, a patient living in a remote area can consult with a top specialist hundreds of miles away without ever leaving their home. This increased accessibility is particularly beneficial for individuals with chronic conditions who require regular monitoring and adjustments to their treatment plans. Additionally, telemedicine has proven to be a game changer for mental health services. The stigma surrounding mental health often prevents individuals from seeking help. However, telemedicine provides a level of privacy and convenience that encourages more people to seek therapy or counseling. For example, a patient can now attend a virtual therapy session during their lunch break without worrying about being seen entering a therapist's office. This convenience not only reduces the stigma but also allows patients to access care at a time and place that suits them best. Telemedicine is also playing a crucial role in improving patient compliance. Studies have shown that patients are more likely to adhere to their treatment plans when they can regularly check in with their healthcare providers. Telemedicine platforms often include features like automated reminders, digital health records, and even virtual support groups. These tools help patients stay on track with their treatment, which is particularly important for managing chronic diseases like diabetes or hypertension. Moreover, telemedicine is revolutionizing emergency care. For instance, stroke patients require immediate assessment and treatment to minimize brain damage. With telemedicine, emergency room doctors in rural hospitals can instantly connect with neurologists in urban centers for guidance on administering clot-busting drugs. This real-time collaboration can make the difference between a full recovery and permanent disability. However, telemedicine is not without its challenges. One of the biggest concerns is the digital divide. Not everyone has access to high-speed internet or the latest technology, which can limit the effectiveness of telemedicine. Additionally, there are concerns about data privacy and security. As more health data is transmitted electronically, there is a greater risk of breaches. It's essential for healthcare providers to implement robust security measures to protect patient information. Another issue is the potential for telemedicine to depersonalize healthcare. While virtual consultations are convenient, they lack the physical interaction that can be crucial for diagnosis and treatment. For example, a physician cannot perform a physical exam or notice subtle changes in a patient's appearance over a video call. This limitation highlights the importance of integrating telemedicine with traditional in-person care, rather than viewing it as a complete replacement. Looking forward, the future of telemedicine seems promising. Advances in artificial intelligence and machine learning are expected to enhance telemedicine platforms, making them more intuitive and capable of providing personalized care. For example, AI could analyze patient data in real time to predict potential health issues before they become serious, allowing for early intervention. Additionally, wearable devices that monitor vital signs could seamlessly integrate with telemedicine platforms, providing doctors with continuous data on their patients' health. Furthermore, the integration of telemedicine with other digital health technologies, such as electronic health records and patient portals, will create a more cohesive healthcare experience. Patients will be able to access their medical history, schedule appointments, and even order prescriptions all from one platform. This integration will not only streamline the healthcare process but also empower patients to take a more active role in managing their health. In conclusion, while telemedicine is not without its challenges, the benefits it offers are undeniable. It has the potential to make healthcare more accessible, convenient, and personalized. As technology continues to evolve, so too will the capabilities of telemedicine, paving the way for a future where quality healthcare is within reach for everyone, regardless of location or socioeconomic status.